co-present. Hi everyone, I'm Patty Van Tynen. I'm the State Adolescent Health Coordinator with the Missouri Department of Health and Senior Services.
And I'm Cynthia Arndt, and I work at the Department of Elementary and Secondary Education in the state of Missouri.
So we're going to share our project. I don't know if they mentioned that the concept maps on each of these projects are on your table. And for us, we realize that our YRBS and other sources of data really show that our adolescents are very healthy in preparing for becoming pregnant later on, and well, now and becoming pregnant later on. We have three goals. Well, our overall goal is to educate and motivate Missouri teens to choose and practice healthy behaviors now and in the future. And we have three main strands of priorities for that. And one is to increase awareness among stakeholders, two, to reframe preconception health, because nobody understands what that means, and that means teens, adults, as well as decision makers. And then the third overall objective is to enhance the curriculum resources that we have and add things to that. We learn more from surveying our students and teachers about what they felt were needs in regard to preconception health, and we frame that in a much very broad context. We have samples of the surveys here and the results for you. For those interested. Our target population, similar to Utah and some of the other states, were teens in school, ages 14 to 18, and also teachers that have access to those teens. Our key partners, obviously, the Department of Health, Department of Education, Department of Health, you know, any program that touched on some aspect of preconception health, and Cynthia will tell you a little bit more about the education partners. We also have the Teen Pregnancy Prevention Partnership Coalition, a foundation on our core team, and University Extension. The poster here, we presented at Missouri Public Health Association. It won first place, and we have gotten a lot of interest from other organizations such as Coordinated School Health, FCCLA, and the March of Dimes State Conference, where we've showcased this information.
Another question we were asked was, what has gone well? And I want to make it clear, I work at the Department of Elementary and Secondary Education. I work with family and consumer science teachers and students. In our office also is the health coordinator. So we're on the same floor in the same office, and we can work together. But I have a real good connection with our teachers and our students. FCCLA stands for the Student Organization, Family, Community Leaders, and Family, Career, and Community Leaders of America. And that's a youth organization that we have great access to. So whenever we started talking about how can we get the input from the youth, it was just very convenient that our spring conference with 1,500 students was going to happen that March. So the survey was created. We also had access at that time to teachers. And as Patty mentioned, we asked then, what does that mean to you all? How would you get the message out? And it was a different understanding between the teachers and the students. But they gave some great ideas to frame what we wanted to do and how we could get the message out. And one of the things, we had a curriculum that the teachers are very familiar with called Ounce of Prevention. And so from that, the information gained from teachers and students is informing how we're working on the revision of the curriculum. So Patty came up with some money from the First Motherhood Grant funding to help support developing the curriculum resources, helping pay for the revision, and then we will take care of this summer doing we'll do a professional development on that curriculum.
And we're actually adding, from the survey results, we're adding 2 additional topics that the students really thought were important that weren't in the original Ounce of Prevention. So we're starting the development of that. Those 2 topics that we're honing in on are STDs and healthy relationships.
And Patty, you want to address the challenges?
Yeah, give those to me. All right, so some of our challenges, as obviously as everybody has said, is the term preconception health. Another challenge is identifying and integrating funding and various resources from the multiple programs and grants, because there's not just one big source of funding to do that, and so that's where relationships come in, very handy and experience. Another challenge is going to be the time for further curriculum resource development, testing that out, and evaluation and refinement. We don't have the resources for that yet, but we're hopeful. And then, of course, once you do all this, the teacher time and administrative support to actually integrate these new resources into the curriculum. We feel like if we're able to do this, and Cynthia and I were talking about this, that we may get a chance to educate as many as 300 teachers, impacting over 6,000 students. So we're hopeful about that, and we're excited about trying to reframe and developing more resources. So